What is cognitive behavioral therapy? Cognitive behavioral therapy (CBT) is a form of psychological treatment that has been demonstrated to be effective for a range of problems including depression, anxiety disorders, alcohol and drug use problems, marital problems, eating disorders and severe mental illness. Numerous research studies suggest that CBT leads to significant improvement in functioning and quality of life. But not everyone who benefits from CBT has a mental health condition. CBT can be an effective tool to help anyone learn how to better manage stressful life situations. Types of cognitive behavioral therapy. CBT encompasses a range of techniques and approaches that address thoughts, emotions, and behaviors. These can range from structured psychotherapies to self-help materials. There are a number of specific types of therapeutic approaches that involve CBT. 1. Cognitive therapy centers on identifying and changing inaccurate or distorted thinking patterns, emotional responses, and behaviors. 2. Dialectical behavior therapy (DBT) addresses thoughts and behaviors while incorporating strategies such as emotional regulation and mindfulness. 3. Multimodal therapy suggests that psychological issues must be treated by addressing 7 different but interconnected modalities, which are behavior, affect, sensation, imagery, cognition, interpersonal factors, and drug-biological considerations. 4. Rational emotive behavior therapy (REBT) involves identifying irrational beliefs, actively challenging these beliefs, and finally learning to recognize and change these thought patterns. How it works. Cognitive behavioral therapy (CBT) can help you make sense of overwhelming problems by breaking them down into smaller parts. In CBT, problems are broken down into 5 main areas. 1. Situations. 2. Thoughts. 3. Emotions. 4. Physical feelings. 5. Actions. CBT is based on the concept of these 5 areas being interconnected and affecting each other. For example, your thoughts about a certain situation can often affect how you feel both physically and emotionally, as well as how you act in response. Goals of cognitive behavioral therapy. Cognitive behavioral therapy is regarded as a short-term method of psychotherapy. Ideally, a client will attend weekly sessions over the course of several months and will then be able to use the strategies and tools discussed in these sessions independently. Because cognitive behavioral therapy is tailored to the needs of the individual, the goals of each therapy session are unique based on the client's personal circumstances. The ultimate goal of CBT is to help clients rethink their own perspectives and thinking patterns, allowing them to take more control over their behavior by separating the actions of others from their own interpretations of the world. On a personal level, the goals of any CBT session may include objectives such as being able to socialize enjoyably, to feel more comfortable conversing or interacting with friends, strangers, or coworkers, to become comfortable forming friendships or intimate relationships, to speak in public, to become more assertive, to overcome performance anxiety, or to overcome any level of depression or trauma. Again, the exact goals of CBT are personalized to the needs of each client. CBT strategies. People often experience thoughts or feelings that reinforce or compound faulty beliefs. Such beliefs can result in problematic behaviors that can affect numerous life areas, including family, romantic relationships, work, and academics. Identify negative thoughts. It is important to learn how thoughts, feelings, and situations can contribute to maladaptive behaviors. 6. The process can be difficult, especially for people who struggle with introspection, but it can ultimately lead to self-discovery and insights that are an essential part of the treatment process. Practice new skills. It is important to start practicing new skills that can then be put into use in real-world situations. For example, a person with a substance use disorder might start practicing new coping skills and rehearsing ways to avoid or deal with social situations that could potentially trigger a relapse. Set goals. Goal setting can be an important step in recovery from mental illness and helping you make changes to improve your health and life. During CBT, a therapist can help with goal-setting skills by teaching you how to identify your goal, distinguish between short and long-term goals, set SMART specific, measurable, attainable, relevant, time-based goals, and focus on the process as much as the end outcome. Problem solve. Learning problem-solving skills can help you identify and solve problems that arise from life stressors, both big and small, and reduce the negative impact of psychological and physical illness. Problem-solving in CBT often involves 5 steps: identifying a problem, generating a list of possible solutions, evaluating the strengths and weaknesses of each possible solution, choosing a solution to implement, and implementing the solution. Point 7. Self-monitor. Also known as diary work, self-monitoring is an important part of CBT that involves tracking behaviors, symptoms, or experiences over time and sharing them with your therapist. Self-monitoring can help provide your therapist with the information needed to provide the best treatment. For example, for eating disorders, self-monitoring may involve keeping track of eating habits as well as any thoughts or feelings that went along with consuming that meal or snack. Point 8. Progress gradually. In most cases, CBT is a gradual process that helps a person take incremental steps towards a behavior change. For example, someone with social anxiety might start by simply imagining anxiety-provoking social situations. Next, they might start practicing conversations with friends, family, and acquaintances. By progressively working toward a larger goal, the process seems less daunting and the goals easier to achieve. Common techniques used in cognitive behavioral therapy. One of the biggest differences between cognitive behavioral therapy and other common types of psychotherapy is the structure of the therapeutic session. Cognitive behavioral therapy is highly structured. A standard session typically follows this protocol. 1. The client and therapist discuss the specific problems that will be their focus for the week. 2. The therapist and client begin planning strategies for how to deal with the stated problems. 3. Together, the client and therapist review the client's homework from the previous week's session and discuss the client's progress. 4. Based on the client's progress and newly determined goals, the therapist assigns new homework for the following week. All of this takes place during a standard 50-minute session. Given the time constraint, sessions are used as a forum for reviewing ideas and checking on progress. Homework is an essential component to the success of the cognitive behavioral model, and it is up to the client to complete the homework tasks and keep up with the expectations that are agreed upon during each counseling session. CBT homework often includes thought experiments, worksheets, and other behavioral learning strategies. Thanks for reaching the end of the video. Subscribe to our channel so you don't miss any of our future videos. Also, if possible, like, comment and share with all your friends. Your help will be of vital importance for our growth. See you later.